is cystic fibrosis, as you can see by the screen. It is a genetic disease. It's characterized by an excess of mucus in a patient's lungs. So if you know someone with cystic fibrosis, they cough a lot, they wheeze a lot, they seem to be like swallowing a lot. That's because of the mucus. It's commonly known as CF, and that's what I'll refer to it a lot in this presentation, but they're both commonly referred or used to refer to this disease. Like I said, it's a genetic disease that's inherited by offspring from the parents. However, there are a lot of complications. It can be serious on its own, and it often is, but a bacterial infection known as Senocepacia syndrome becomes life-threatening for CF patients, even though that infection is almost completely harmless for humans. So like I said earlier, Senocepacia syndrome is very serious for people with CF. Since CF is characterized by buildup of mucus inside the lungs and digestive tracts, along with other areas of the body, this disease becomes more serious because it targets those kind of problems. One is able to live with the disease effectively, but it becomes far more with cystic fibrosis effectively, but it becomes far more dire if the CF patient is infected with the full name is Burkholderia Senocepacia or B. Senocepacia. It's completely harmless in normal humans, so I don't believe it's very common, but you could get it and just be completely fine. But if you have cystic fibrosis, it leads to an additional disease called Senocepacia syndrome. The Burkholderia Senocepacia pertains to a family of bacteria known as Burkholderia, and those infections are incredibly painful and difficult for CF patients. The leading cause of death for CF patients is inflammation as one, but the other is also respiratory diseases like pneumonia or Senocepacia syndrome. Strains of this have been commonly found in New Zealand, Australia, and parts of Europe, but there are other isolated strains that are more common in North America, specifically Canada. This infection can spread in human-to-human contact, like most diseases. Similar to what we have now, it can spread via droplets, or it can spread from the environment, as strains have been detected in the soil as well. So you have to be careful. If you have CF, it's not something that you'd actively be taking precautions against because it's so hard to stop yourself from getting it. So you'd almost just have to live life and just, in my opinion, you just want to live life and hope you don't get it. While it is somewhat rare among those who have been infected with CF, it is a devastating infection for those with lungs weakened by CF. So it's definitely something to be careful of. Okay. I'm not sure why this isn't working. I'm using my dad's work stuff, so it's like a dual monitor, and I don't really know how to use it. The mode of inheritance for cystic fibrosis, it's an autosomal recessive disorder, and that means that one can carry the allele in their genotype, but not express in their phenotype because it is a recessive gene. So it's actually fairly common, especially among white people in America, to carry the disease, or less commonly have it if they inherit two recessive alleles. If it is masked by a dominant gene, it doesn't really have a noticeable expression in the person, so it's not like a sort of partial dominance, but if expressed, it causes a defect in the cystic fibrosis transmembrane receptor, or CFTR gene. CFTR manufactures the protein producing mucus, digestive fluid, and sweat. There are over 2,000 CFTR mutations, which makes it very difficult to try to find a cure for something like cystic fibrosis. And if both parents are carriers, it is possible for the offspring to express one of those 2,000 CFTR mutations. Symptoms vary from person to person based on the severity of the disease. So you might see someone who has a very mild case of CF and not even know it until they become older than 18 or even into their 20s or 30s, and then they start to have some trouble breathing or symptoms like that. It can improve or worsen over the time depending on the case, similar to asthma, but CF tends to worsen over time rather than improve. Some may not even experience, as I said, or receive a diagnosis until adulthood. In these cases, it's generally a very mild case, so normally they can live with it just fine. But the symptoms, if there are any, are more abnormal, such as pancreatitis, which is a symptom of the pancreas, which you wouldn't expect to come from a lung disease, but it affects it. The CFTR mutation affects a lot of different things sometimes. It also includes the most common symptoms include wheezing, difficulty exercising, and frequent lung infections such as pneumonia. And that one can be especially detrimental because when the lungs are already so weak, then you throw in some sort of lung infection like sinus aphasia syndrome or pneumonia. It can be especially detrimental. Recurring sinusitis, congestion, and inflamed nasal passages, and a persistent cough that leads to thick mucus. I actually personally know someone with CF, so a lot of times that one is a big one. So like you can, if you're around them, sometimes they'll be fine for a while, but also sometimes they'll get into coughing fits where they'll just cough and continue to cough for like a while, and it's not like super long, like you'll be in conversation with them and then they'll figure it out, but like they'll be coughing up a lot of mucus and you'll be able to hear that. It also includes digestive symptoms such as inhibited growth and slowed weight gain, intestinal blockage, especially in infants, which can be especially a problem, frequent greasy and bulky stool, which gross, and chronic constipation, again gross. The symptoms that arise from from the extreme excess of mucus make CF unique from other respiratory and digestive diseases. They can be life-threatening to both children and adults, so just because you're older doesn't mean you are free from it. In fact, it often gets worse. The genetic disease is more prevalent in white Americans. For about 1 out of every 3,500 babies is born with CF in America. There's no real reason for this other than the fact that the allele just must have been more present from the beginning from an evolutionary standpoint. The risk is far less actually for Hispanic Americans, which is 1 in 10,000, and African Americans are 1 in 20,000. In Asian Americans, it's almost obsolete. Well, not obsolete, it still happens, but it's far less compared to